Good morning, everyone, and welcome to the August, can't believe it's August already, GHA Data Services User Group. We appreciate your taking your time out of your morning to join us to review some data updates and discuss and receive your feedback from the strategic planning tool. This call is being recorded, and the slides and the recording will be available on the GHA website under the Data Services area. Also, if you have any questions, please feel free to unmute yourself at any time to jump in. This is your meeting, and we are also monitoring the chat box if you're more comfortable posing a question there. So we'll get started. We have not an extensive agenda, but we do have a few things we want to go over, especially if we have any new users. Want to give everyone kind of the background for this meeting. We've got the GDDS overview, some updates, data refreshes, an update on the 2021 data closure and limited data set monthly data release. Bill has some member reports he wants to preview a little bit, and then I have a couple of quick things to point out on Advantage Optics. As always, I'd like to give an overview of what the Georgia Discharge Data System is, GDDS. It is the state mandate that hospitals in Georgia submit their inpatient and outpatient data, and we are the vendor for the state. And we also have partnered with a subsidiary of the Missouri Hospital Association, HIDE, and they are our vendor to receive your data. And so the data is submitted to HIDE in the UB04 data format. It is then processed and vetted and taken through a series of validations and edit checks, and different geographical codes are added, service line codes are added to the data, and then it becomes the Georgia Discharge Data System. After that, GHA submits that data on your behalf to the Brain and Spinal Trust Fund Commission, to the state. And then for research purposes, so that we have a systematic process of reviewing search and reviewing and vetting research requests, we've partnered with the AHRQ, AHA's AHRQ, and the HCUP Healthcare Cost and Utilization Project. They take all those data requests and they review them first based on our criteria, and then they send those along to GHA for an additional review. And then if we approve that request, that data is then distributed by AHRQ, a de-identified set of data, to the requester. So does anybody have any questions about the Georgia Discharge Data System and how that process works? And then, of course, after the GDDS has been available and now it is distributed monthly, we publish that on the new GHA Advantage Optics outfacing tool for you to use for strategic planning purposes, to monitor your volumes and review your data. And it's all hospitals that submit their wide aggregate data. All right, I'm going to turn it over to Sharifa to give us a quick update on our submission schedule for 2022.
Good morning, everyone. Yes, so the schedule, well, we're moving right along. Like Leslie said, we can't believe it's already August, but this month we have June data due on the 15th. And as you know, we're on this monthly schedule, but really it's a 45-day rolling period. So you have an extra 2 weeks. So 2 weeks into August to submit your June data. And of course, for our Quality Works hospitals, the June data will be, was due in July. So just remember that, July 20th. And so we also have closed 2021. So Q5 is in the process of being reviewed, and then will be published, and then will be closed for good. So thank you for everyone for submitting any corrections or resubmitting your data for 2021 to make sure that it's as clean as possible, for responding to my emails and cooperating with me. So I do appreciate that. And if you go to Advantage Optics, those who have access to it, you'll see that May data has already been published. So we do have a quarter complete, so quarter one, and then we have April and May in there. So that's also one of the benefits of that new platform, is that the data is in there pretty quickly. I would say about 10 business days after the refresh. And you can go to the next slide, Leslie. Or is there anything you'd like to add? So, and this is something that I took from Advantage Optics, just to show the overall discharge count for inpatient and outpatient data. And you can get that information by going there. So if you want to zone in on your facility, you can do that, or you can look at all the facilities, do some comparisons, and look at your numbers, and they should be pretty accurate compared to what you have in your internal system. Next slide. You can also look at discharge by demographics. So if you want to just do some analysis on that, and you can click on each bar that you see on these graphs. You can click on each one to just zone in on one particular, if you want to look at one particular race or ethnicity, or look at females versus males or age group, you can do that, and all the quadrants will be updated based on what you clicked on. So this is just to show you inpatient and outpatient discharge by demographics and just an overview, and then you can go more granular if you want to. Same thing for a payer category, and there's a legend there where you can see how many Medicare, commercial, Medicaid, self-pay, etc. Or if you want to do just the payer types, that'll be more, more specific or more in detail, and you can again click on the different colors that are associated with each of the payer categories and see where you lie, or do your analysis that way. And so for those of you who haven't been on Advantage Optics that have access, I would recommend that you do that just to take a look. It's kind of like looking at your verification report for the HIDE users on the HIDE.net website. It's kind of giving you, it helps you kind of review your data, giving you the overview or overall idea of where your data is and how it looks, and your volumes and distributions. So it's a great way to do your verification, just go a little bit deeper. And if you have any questions or you see any issues, because it's a monthly submission, you can catch it early. We can work on that, on fixing that together. And that's what I do as well for most of the hospitals. But I do recommend you just go in there, and if you have any feedback on what we can do to improve this or what you'd like to see, just let us know. Are there any questions?
That's a really good point, Sharifa, to use the Advantage Optics tool kind of as a cross-check to the verification report, because this is more interactive than the verification reports. We have asked HIDE to, and they are working on the HIDE.net, which is the upload portal, and we've asked them to add some of this more visual graphics to that portal, so that you have that capability on the verification side as well, where you upload your data. But it's a great way to balance looking at those static verification reports with these more interactive visuals that you can work with on Advantage Optics. And the other thing I would point out is that, if you haven't logged into Advantage Optics, please let Sharifa or myself know. Everyone who previously had an account was set up and sent their credentials back in April, I believe. I know that sometimes that gets lost in spam, and you're busy, and until you don't realize that you haven't logged in until you need to look something up. But Sharif and I can assist you in logging in and getting you set up. And if you have other users that you want to add to this, we'd be happy to send you the authorization form. It's very easy. Just sign the authorization, have a C-level authorize that person, and we can set you up just immediately. So actually, it's a little bit easier process than we had before. Sharif and I now have administration rights to set people up both on the HIDE.net side to authorize users to upload data, and also to access the Advantage Optics portal. So again, that would be Sharifa and myself that have administrative rights to do that. Any questions? Remember, you can type a question or comment in the chat box as well. If not, I'm going to ask Bill to talk about some upcoming reports that will be placed in the member folders.
Thanks, Leslie, and welcome everyone to this call today. Thank you for being here with us. This is proposed rule season for any of the Medicare rules that are calendar based. So we'll be posting several of these in your member folders over the next couple of days. The big one that's out now is the outpatient PPS proposed rule. This will be put in your folders probably by the end of the day today or worse tomorrow. And that's got the analysis of all of the proposed rules for the outpatient side. It incorporates some of the 340B changes that are known that are not still out there for public comment based on the recent lawsuit. I was trying to think, there was another one that was in there. I think it's got the wage stopgap 5% in there as well. So you can go through and see the impact of the PPS rule, outpatient PPS rule for every one of the hospitals. The other one that's in there right now that a lot of folks like is the Medicare fee-for-service margin analysis. You can go in and see how you compare to other hospitals in the state and the U.S. Based on all the different categories. So you can do your total margins, you can do just swing bed, SNF, outpatient, and you can also include what to add. So if you do your total, you exclude dish, things like that, and you can just kind of see where you compare to your peers. The data actually goes back in this one to 2011, so you can there's really good trending to see where you fit in. So a lot of people like that one. The other one that's in there that I kind of want to take a few minutes to talk about is the analysis of the rural emergency hospital rule that has come out. This is the new hospital designation that could start in 2023 for hospitals 50 beds or under, or critical access hospitals, to convert to being essentially a freestanding emergency room, observation services, some OB type services, prenatal, postnatal, and very low complication pregnancies. And then obviously hospitals that have SNFs and things like that, they can keep those as long as they're under a separate NPI or an off campus. The analysis is now based on what's also in the outpatient proposed rule, which included the monthly add-on payment. I think it adds up to be roughly $3.2 million a year for the hospitals that do convert to the rural emergency hospital. And then anything that would be paid under the outpatient PPS is paid at that rate plus 5%. So that analysis is in there. It's actually a PDF, and it's I think we have 47 hospitals, I think it's right, that could potentially convert. So it gives you an analysis of what it would look like with the 5% add-on for the OPPS plus anything that you had already had revenue-wise from Medicare on SNF and other outpatient, and then adding the $3.2 million add-on, facility fee add-on. And it'll give you an analysis of whether it's something to consider, no reason to consider it, it's not worth it, or it's an automatic for you. So that's in there. We'll be sending that out. We'll talk about that too at the Center for Rural Health meeting in a couple of weeks, but wanted to get that into the hospital's hands now. The original analysis that we got showed no hospital in Georgia would benefit from becoming an REH, but that was before the OPPS rule came out with the monthly facility fee. So that's changed the dynamics for a few of the hospitals in that report. So maybe something you want to take a look at it and see if it's something to explore. Each one of these actually has a write-up or a policy brief or an analysis, so you can kind of see exactly what was included in those calculations and how to incorporate that in your own projections. So be more than happy to take any questions, but those will be posted in the folders this week or so. We got them all pretty much yesterday.
Thanks, Bill. Any questions for Bill? And Bill, tell us who has access to these reports.
All the C-level is granted automatic access, CEO, CFO, COOs, anyone like that. Because we use these reports to distribute the economic impact report, PR folks have access, and then anyone else that the hospital has requested. So a number of the folks have their reimbursement directors and people like that have access. So we can give anyone that wants it. We just typically ask for an email from a CEO, CFO, somebody like that requesting access for that individual.
Great. Thank you. So if you need access, you would just simply need to have your C-level email Bill or Sharifa to and identify that person, and we can set that up as well. And that is on the GHA website under the data services area. And there's a tab called member reports, and that's where the member reports are organized by finance, by quality, by policy, I believe is another subfolder. So that is there for your use. And we partner with DataGen to provide these reports to you every year. All right, great, thank you. Moving on, we're still excited about Advantage Optics, and I keep the slide in here because I just want to remind everyone where we've kind of been and the progress we've made. Moving our data has always been with Heidi, but moving the outward facing platform back to Heidi for your use under Advantage Optics allows us to have one platform for all of our data. Again, it's a Tableau-based platform where you can save your reports or your views is the more accurate terminology, so that you can go back to a view that you frequently use. You can identify your service area by zip code or county or by specific hospital, and you can run reports that way. There's flexibility in the dashboards, and as Sharif has already mentioned, there are monthly updates, and we already have May of 2022 live in the system. There's advanced filtering, and there is a data download tab that is very robust and allows you to download a subset of the data. One thing I wanted to update is, and this has been on our list, but they're still working on updating or adding the inpatient DRG service line groupings. That data is to be determined. We're pressing hard to get that make that available as soon as possible. The outpatient service line groupings have been added back to the tool, the CCS. So you'll see that as a filter. In addition to the CCSR body systems are available. And the one thing I did want to remind you is that we have partnered. There are, what was it, Bill, 18 other states that participate in the non-resident data program with Heidi.
That's right. I think it's 18.
I think it's 18. We saw them. I should have put the map up here. So, one thing to keep in mind when you're working in Advantage Optics is that Georgia or that non-resident hospital, those hospitals could be included and that data could be included. So if you only want to filter on Georgia, you would go to the service area and select the Georgia regions. And I've got a screenshot right here. I know it's a little bit tiny, but it shows Georgia Central, East Central, North Central, Northern, Southeast, and Southwest. So if you wanted to only choose the Georgia regions, then you could click on the filter at the top right, apply additional filters. And then on the right-hand side, it's called service area. And you would just select the Georgia, those Georgia regions, and then click apply. And then that would, filter it to only include the Georgia data. All right, I see somebody's needing access, so we will make sure we send you the authorization form, or we'll check to see if you've been added as a user, and then if not, we'll send you the authorization form. So does anybody have any questions about this and the way you can, I know this is small, but you can see there's a lot of different filters that can be applied. You can really kind of get lost, not lost, but go down a rabbit hole on using all these filters and all these dashboards. But we've really enjoyed working with several hospitals to work on identifying their service area and kind of guiding them in the right direction to explore what other service lines they may be interested in, or where, how they're serving their communities at their hospital. Bill, did you want to add anything?
No, actually, I was about to respond. There was one in there that check and add them. I was about to respond to that. Sorry.
The date for the final 2021 data to be loaded into Advantage Optics should be by the end of, I believe, by the beginning of next week. And so that limited data set will follow as well. Sharifa, is that accurate?
Yeah, that's accurate.
So the limited data set for those who subscribe to that will be distributed by the beginning of next week. All right, that is our agenda for today, and I certainly don't want to take up any more time, and we do have a question. This is great. Does the non-resident data include Georgia residents who were admitted to out-of-state hospitals? Yes, it does. Other questions, and I'd love to hear what your thoughts are on the Advantage Optics. If you've had the opportunity to use it, if you have any feedback, I would love to hear from anyone through chat, or feel free to unmute yourself to ask a question or make a comment about Advantage Optics or anything data related.
Yes, could you repeat the answer to the question that Christina posed? I wasn't able to hear it.
I apologize. Her question again was, does the non-resident data include Georgia residents who were admitted to out-of-state hospitals? And the answer is yes, it does. Now, it's not as detailed data. It's more of a head count, but yes, it is. That is included, which is why we participate in that sharing. And currently it's only inpatient.
Right.
It's an important note.
And we have figured out it's not as updated as ours. I think it updates every quarter. We're one of the few states that have the monthly update, the monthly submission and the monthly refresh.
Yes, I see your comment about the care service line.
Yeah, we're pushing them.
Yep. Again, this is your time, so we don't want to prolong. If there are no other comments or questions, we would appreciate, however, if there are other topics that you would like to see covered or any other demonstrations with Advantage Optics, if you would let us know that, we would love to incorporate that into our next meeting, which will be on September the 14th. And that's a week. Usually we meet the first Wednesday of the month, and we've pushed that off a week because we had a scheduling conflict. So that will be September the 14th. And, we'll go over any updates that we have then, and hopefully we'll be able to report to you at least by then that those care service lines have been included and incorporated into Advantage Optics. Lastly, I'd like to just, that's our contact information, and Sharif and I are happy to do any demonstrations or training with you or your team over Zoom for Advantage Optics or in reviewing your data. So please don't hesitate to reach out to us. We're always available for you. And we just appreciate your time today, and let us know if you need anything.